Good morning, everyone. Today, we are going to discuss an important topic in nutrition and healthcare, which is dietary management for diabetes patients. Diabetes is a chronic metabolic disease that affects millions of people worldwide, and proper dietary management plays a crucial role in controlling blood glucose levels and preventing complications. First, let us briefly understand what diabetes is. Diabetes occurs when the body cannot produce enough insulin or cannot use insulin effectively. Insulin is a hormone that helps glucose enter the cells to be used as energy. When this process is disrupted, glucose builds up in the blood, leading to high blood sugar levels, also known as hyperglycemia. Over time, uncontrolled diabetes can cause serious complications such as heart disease, kidney failure, nerve damage, and vision problems. There are two main types of diabetes that require dietary management: Type 1 diabetes and Type 2 diabetes. Type 1 diabetes usually develops at a young age and requires lifelong insulin therapy. Type 2 diabetes is more common and is often related to lifestyle factors such as poor diet, lack of physical activity, and obesity. Although the causes differ, dietary management is essential for both types. One of the primary goals of dietary management for diabetes patients is maintaining stable blood glucose levels. This can be achieved by controlling carbohydrate intake, choosing the right types of food, and eating at regular times. Carbohydrates have the most direct impact on blood sugar levels because they are broken down into glucose during digestion. Therefore, understanding carbohydrates is a key part of diabetes nutrition education. Carbohydrates can be divided into simple carbohydrates and complex carbohydrates. Simple carbohydrates, such as sugar, candy, sweetened beverages, and pastries, are quickly absorbed into the bloodstream and can cause rapid spikes in blood sugar. On the other hand, complex carbohydrates, such as whole grains, legumes, vegetables, and fruits, are digested more slowly and help maintain more stable blood glucose levels. For this reason, diabetes patients are encouraged to limit simple sugars and choose complex carbohydrates whenever possible. Another important concept in dietary management is portion control. Even healthy foods can raise blood sugar levels if consumed in large amounts. Portion control helps patients manage calorie intake and avoid excessive carbohydrate consumption. Using tools such as measuring cups, food scales, or the plate method can be very helpful. The plate method, for example, suggests filling half the plate with non-starchy vegetables, 1/4 with lean protein, and 1/4 with whole grains or other healthy carbohydrates. In addition to carbohydrates, protein plays an important role in diabetes management. Protein helps maintain muscle mass, supports body functions, and provides a feeling of fullness, which can help prevent overeating. Good sources of protein include fish, skinless poultry, eggs, tofu, legumes, and low-fat dairy products. Protein generally has little effect on blood glucose levels, but it should still be consumed in appropriate amounts. Fat intake is another key consideration. Not all fats are the same, and choosing healthy fats is essential for diabetes patients. Saturated fats and trans fats, commonly found in fried foods, processed snacks, and fatty meats, can increase the risk of cardiovascular disease, which is already higher in people with diabetes. In contrast, unsaturated fats, such as those found in olive oil, nuts, seeds, and avocados, are healthier choices when consumed in moderation. Fiber is also a critical component of a diabetes-friendly diet. Dietary fiber slows down the absorption of glucose, helping to prevent sharp increases in blood sugar levels. High-fiber foods include whole grains, vegetables, fruits with skin, and legumes. Increasing fiber intake can also improve digestion and support heart health. Meal timing and consistency are equally important in dietary management. Eating meals and snacks at regular intervals helps maintain stable blood glucose levels throughout the day. Skipping meals can lead to low blood sugar, especially in patients who use insulin or certain oral medications. Therefore, patients are often advised to eat 3 balanced meals per day, with healthy snacks if needed. Another important aspect is reading nutrition labels. Diabetes patients need to pay close attention to serving size, total carbohydrates, added sugars, fiber, and fat content. Nutrition labels provide valuable information that helps patients make informed food choices. For example, foods labeled as sugar-free may still contain carbohydrates that affect blood glucose levels. Hydration also plays a role in diabetes management. Drinking enough water helps the kidneys remove excess glucose from the blood through urine. Patients are encouraged to choose water, unsweetened tea, or sugar-free beverages instead of sugary drinks, such as soda and sweetened juices. It is also important to consider cultural and individual preferences when planning a diabetes diet. A successful dietary plan should be realistic, enjoyable, and sustainable. Patients are more likely to follow dietary recommendations if they can still enjoy their favorite foods in controlled portions. Finally, dietary management for diabetes patients should always be combined with regular physical activity, medication adherence, and routine blood glucose monitoring. Nutrition alone is not enough. It is part of a comprehensive diabetes management plan. Healthcare professionals, including doctors, dietitians, and nurses, play a vital role in educating and supporting patients. In conclusion, dietary management is a cornerstone of diabetes care. By controlling carbohydrate intake, choosing healthy foods, managing portions, and maintaining regular meal patterns, diabetes patients can achieve better blood glucose control and improve their overall quality of life. Understanding these principles is essential for anyone working in the healthcare field, as well as for patients living with diabetes themselves. Answer the following questions based on the tape. 1. What is the main role of insulin in the body? A. To store fat in the body. B. To help glucose enter cells for energy. C. To break down protein. D. To control digestion. 2. What happens when insulin does not work properly? A. Blood pressure increases. B. Glucose is excreted immediately. C. Glucose builds up in the blood. D. Muscle mass decreases. 3. Which type of diabetes is often related to lifestyle factors? A. Gestational diabetes. B. Type 1 diabetes. C. Type 2 diabetes. D. Juvenile diabetes. For what is the main goal of dietary management for diabetes patients? A. Eliminating carbohydrates completely. B. Maintaining stable blood glucose levels. C. Increasing calorie intake. D. Avoiding all fats. 5. Which nutrient has the most direct effect on blood sugar levels? A. Protein. B. Fat. C. Fiber. D. Carbohydrates. 6. Which of the following is an example of a simple carbohydrate? A. Whole grains. B. Legumes. C. Sweetened beverages. D. Vegetables. 7. Why are complex carbohydrates recommended for diabetes patients? A. They contain more fat. B. They are absorbed more slowly. C. They increase appetite. D. They have no calories. 8. What is the purpose of portion control in diabetes management? A. To reduce water intake. B. To eliminate protein. C. To manage calorie and carbohydrate intake. D. To increase meal frequency. 9. According to the plate method, what should fill half of the plate? A. Whole grains. B. Lean protein. C. Non-starchy vegetables. D. Fruits. 10. Which protein source is considered a healthy option for diabetes patients? A. Fried sausage. B. Skinless poultry. C. Processed meat. D. High-fat cheese. 11. Why should saturated and trans fats be limited? A. They increase fiber absorption. B. They raise blood glucose quickly. C. They increase the risk of heart disease. D. They reduce insulin production. 12. How does dietary fiber help diabetes patients? A. It increases sugar absorption. B. It slows glucose absorption. C. It replaces insulin. D. It eliminates carbohydrates. 13. Why is regular meal timing important for diabetes patients? A. To increase appetite. B. To avoid digestion problems. C. To maintain stable blood glucose levels. D. To reduce physical activity. 14. What information on nutrition labels is especially important for diabetes patients? A. Brand name and price. B. Expiration date only. C. Total carbohydrates and added sugars. D. Package design. 15. According to the speaker, dietary management should be combined with which of the following? A. Only medication. B. Physical activity and blood glucose monitoring. C. Herbal supplements. D. Fasting regularly.